Welcome to the Executive Talk, where we sit down with entrepreneurs whose bold journeys are shaping the future of business in Vietnam and beyond. I'm your host, Xuân. Vietnam is emerging as a promising market for medical equipment, driven by an aging population and growing demand for higher quality healthcare services. Although Vietnam still relies heavily on imported devices, domestically produced medical equipment is quickly gaining ground. These homegrown products not only offer patients more affordable options, but also demonstrates Vietnam's rising capability to manufacture and increasingly export high-tech, made-in-Vietnam medical equipment.
A stent, a high-tech medical device, is a tiny wire mesh tube used to keep an artery open, helping restore blood flow to the heart. Manufacturing stents is highly complex, requiring advanced technology and rigorous production standards, as the device remains inside the blood vessel for a lifetime to help prevent heart attacks. The materials used must be highly biocompatible and meet strict sterility, biological and chemical requirements. In 2019, Vietnam's first domestically produced coronary stent was officially introduced and put into use nationwide. At the time, it was priced around 30% lower than imported alternatives, offering patients, especially those in difficult circumstances, a greater chance of accessing life-saving treatment and improving their quality of life. The product meets international ISO standards for quality management systems, environmental management systems, and medical device quality management. It is now also being exported to markets including Germany.
In order to learn more about what it takes to build a made-in-Vietnam success story in such a demanding, highly regulated industry, today we welcome a woman who turned an impossible dream into a remarkable reality. Thank you so much for joining us today, and welcome to the show.
Yeah, thank you for inviting me to come today, and we can share our story to you and everybody.
So with your coronary stent, you became one of two Southeast Asian countries that can produce this very complex, very high precision medical product. What motivated you to choose the path of local manufacturing instead of importing or distributing?
I come to medical device now 30 years and work for medical device company, Singaporean company. Import product and sell to the market. When I go to US, a lot of Vietnamese can work for the MedTech. I want to have the one brand product in Vietnam. That's why I invite they come and they help us to grow this company. When we import the product very easily and get more profit than produce the high-tech medical device product. And in Vietnam, we think that the developing country and Vietnam, we need the local company who can produce the product, can serve poor people also. The first stand put on the patient in Chợ Rẫy Hospital. Yeah. At that day, I cannot sleep all night. Yeah. All my team cannot sleep. This is very important because we don't know what happened in future. Right. Even we already put on the pig for animal, but for the patient, you will win or you will die. Right. So that's very important. When the doctor in Chợ Rẫy Hospital take a picture of our box and send to me, and they post on the Yellow, they said that this is the first stand in Vietnam successful on the patient. I think everybody in our team at that day, we would like to try for that also.
Is there a touching story along your journey that really stands out that you want to tell people?
My father, 7 years ago, he has the attack. And at that time, doctor called me, say that your father need to put the stent. At that time, he's 78. I told with the doctor, I said that, okay, we have the stent. And I believe my stent can, but we believe our technology. But depends on the disease. You can choose any kind of the stent to suitable for my father. Yeah, I let the doctor make decision. Dr. Dũng, professor. So he told me, bring your stand, come here. So we don't know what size. So we bring a lot of stand, go to the hospital. And he told me that, congratulations, we put your stand in your father and successful. And up to now, my father still very healthy, over 7 years. One day, I received the call from Dr. Trung in Chợ Hospital. He told me that he had the one patient, they very poor, and he don't have insurance also. Doctor asked me, can you sponsor for this case? I said that how many stand he needed? He said that 4 stand. Because with 4 stand, you use the foreigner product. The patient had to pay, I think, 800 million. How to pay? So that's why I said that, okay, you do it. I will sponsor the stand for you to do it, to rescue the patient. Many patients receive the sponsor from us like that. This is, I think, this is the present for us.
That choice to manufacture instead of import was very bold. It went along with the government's growing focus on make in Vietnam, innovation, and industrial autonomy. So how did that national momentum and policy environment influence your decision to invest in local R&D and production? Were there specific incentives or programs that supported you at the early stage?
For the first stage, when we start up this company, of course, very difficult. I don't know how to start it. But when I come here with the high tech park, and we talk with them about our plan to build a factory, and they support for local company, and they very interesting about the product we will produce. That's why they show us and they support us how to make to help us for the project, very short term, to give up the land, and the support for the tax, support for the land and the rental and everything. The government step to step to support us. Look like a child, and they support you. When I have any difficulty, I come to talk, and then they will help us to open, and that's why we can grow up. Ho Chi Minh City give us support us for the loan interest for 7 years. That's why I don't worry much for the payment for the interest.
According to the World Health Organization, cardiovascular diseases remain the leading cause of death globally, claiming an estimated 17.9 million lives each year. In Vietnam, these diseases account for around 200,000 deaths annually, more than 30% of total fatalities. This has led to a growing number of patients requiring cardiac treatment and intervention.
Hàng năm chúng tôi điều trị cũng khá nhiều những cái bệnh lý về tim mạch nói chung. Thì trong đó thì cái bệnh động mạch vành là một trong những cái mảng bệnh lớn, và cái số lượng bệnh nhân đến bệnh viện Đại học Y Dược cũng khá nhiều. Tính chung là mỗi năm chúng tôi có khoảng từ 1.000 cho đến 1.200 ca là có bệnh mạch vành mà đòi hỏi phải can thiệp động mạch vành qua da.
Coronary stenting is a common and effective method in the treatment of heart disease. However, most stents and interventional equipment are still imported. While health insurance covers part of the cost, many patients, especially those from disadvantaged backgrounds, continue to face significant financial barriers.
Điều này thì ảnh hưởng đến cái chi phí giá thành cho thủ thuật chụp và can thiệp mạch vành, vừa là kỹ thuật cao trong vấn đề đầu tư các trang thiết bị máy móc, vừa phải tốn kém rất nhiều về vấn đề vật tư tiêu hao, do đó giá thành chi phí cho điều trị nó tăng cao.
A coronary stent typically costs patients around $3,000 or more. With the goal of making life-saving technologies more accessible, This Vietnamese company has successfully developed domestically produced coronary stents. Thanks to these locally made products, patients may now pay only a few $100s after health insurance coverage, significantly easing the financial burden.
You've spoken from the beginning about the social dimension of your business. A patient saved is the true success, not how many units sold. How does that social mission mindset influence your business model, your product pricing, and your market choices?
Because we are the business, we cannot say that we make this and no profit. Yeah, but priority is the patient first. For us, the priority is we have to based on the patient result. This is our target. And the second one, for the profitable, we can service. We can, in my company now, we have over 200 employees. All of the staff, they can have the work, and they can take care of their family also. Everything be the same with the foreign product. Example, for material, the same. But only for labor cost, we are less than foreigner. That's why we accepted for the profit to reduce. And then we serve for our country with the acceptable price and lower price compared to foreign. We don't want to change material for reduced cost, but we keep the same and we give them the best product quality. Yeah.
What were your biggest engineering or regulatory challenges in making the transition from import or assembly to full-fledged domestic production of stents?
For the product, totally different from import product or production, totally different. And the regulatory in Vietnam or Europe or US, the same. Vietnam, we are not have the expert for medical device engineering. University have education, but they don't have experience. Yeah, that's why from beginning, the personal training very important in our company. From beginning, we open to collect the new student come from university, technology university. They come, and then we send them out to overseas for training from beginning. That's why all of my team, for the management team now, they work with me over 10 years. I think in future, Vietnam, so if you want to be the open for the medtech, university need to be something to invest for the education. We go by step, build the factory, send engineer go to overseas, invite the expert to Vietnam for training for them and work with us for a few years, and the lab, the testing, and then we get a license. We have some doctor from overseas, from US, they come to Vietnam, and then they go with us. They go with them. So that's why we make some workshop, some training, then show for them the result of clinical trial, and then we go with the doctor for the study.
Mastering the science behind coronary stents requires precision at the micron level, combining advanced metallurgy, surface coating technology, and controlled drug release. The company has developed each stage in-house, adhering to international standards while continuously refining its proprietary technologies. The production process follows WHO Good Manufacturing Practice or GMP standards, with strict control from input to output. While its coronary stent was first researched in 2012 and received commercial licensing in 2016, the company's nanotechnology-based angioplasty balloon and drug-eluting stent have been under research and implementation since 2013. In addition to coronary stents, the company now produces balloon catheters and other interventional cardiology accessories. Its plate screw systems for orthopedic surgery and drug-eluting coronary stent system were recognized as Vietnam national brand products in 2024 by the Ministry of Industry and Trade.
Quality is, of course, critical, like you said earlier. in medical devices. What is your philosophy and strategy around quality assurance and innovation? How do you ensure your product is trusted by physicians and patients?
Medical device, always the safety is the first priority. And then more we have to concern for the quality. Because after the patient to safety or not, when they put your stent, put it in, and we have some policy in our company. Because it's a training for the patient, training for the staff also. When they work, do the product, when the testing, they have to think this stent can be used for their family. It's been very important. You cannot, when you find that this have something wrong, this it can the damage. Yeah, very dangerous for the patient. That's why we always take the training for the staff, for all of the person in the company. Every some months we have to repeat again. We have to make sure that we go to the market with the quality control. I don't want any risk for the patient. That's why we don't want any risk for the company, and that's why the worker, when they do that, they have to make the very high concern about the quality. Very important. We have to follow the regulation. We have to follow the quality of the international quality. That's why all the process we do the same with the international company when they produce the stent.
With strict international standards such as ISO 13485 and CE certification, how do you balance compliance costs with competitiveness, especially when scaling up exports?
When we invest for the ISO and we invest for the CE certification, it takes a lot of cost. The regulation very strictly for the producer stand. So from beginning, when I make the company, we go from beginning. So that's why very hard, very tough. But this is the investment. Yeah. So that's why I think this is investment the same you invest for the machine. Yeah. So that's why we go ahead for that. Of course, if we invest for this certification, will be make it a lot of cost higher than we don't do it. Because when we export to any country, we need this one. Yeah, so that's why we follow up.
Could you share a breakthrough or an innovation at USM that you're really proud of? Something that demonstrates Vietnam's ability to match world-class standards.
I'm very proud about our team. Yeah, we can go to global. Yeah, that's why every year we attend the trade show in Germany. And a lot of some quite order come from overseas, but and our team from R&D for production open to do it, and they can meet the requirement of the customer from overseas. That's why we export some country. Yeah, some country they cannot develop. They only can do the stand, the bare stand. It's been not the drug coating, but we successful for the 2 drug coating for sirolimus and everolimus, and even we can do for the drug or the balloon also. So that's why almost the latest technology on the world for the stand. So that's why we can compete with the foreign product. Yeah.
In addition to its capabilities in domestic manufacturing, the company is now exporting to markets including Germany, Japan, and Indonesia, while steadily integrating into global supply chains. Looking ahead, it is targeting further expansion across Southeast Asia, a dynamic market of more than 700 million people. To support this growth, the company has prioritized the adoption of smart management systems and information technology from an early stage. It is expanding automation across key production processes. At the same time, the integration of IoT and smart sensors enables real-time monitoring across the entire production line, boosting productivity, minimizing errors, and optimizing maintenance operations. A core strategic focus is the connection of its manufacturing systems to big data platforms, allowing for performance analysis, demand forecasting, and more precise operational decision-making. This digital transformation not only reduces costs, but also ensures absolute consistency in product quality. In parallel, the company is preparing to roll out a comprehensive traceability system, ensuring that every product is accompanied by a complete electronic technical record, an essential requirement for accessing demanding markets such as the EU, the United States, and Japan.
You've also spoken about pushing for made in Vietnam, high-tech devices, and a long-term investment into R&D rather than purely trading or importing. In today's world of global supply chains, what do you believe are the advantages and risks of being a local manufacturer in Vietnam?
If we want to be changed from local game to be global, we have to invest a lot from R&D because medical device, medtech, every day they increase. They have a lot of product going out. So that's why for us, we always to invest for R&D, the study, and then we guide for them to have the new and the latest technology for invest for the company. But we need more support from the government if we would like to be more and more invest for the high-tech technology. Vietnam have the good talent for own of the company, not only Vietnam, but not only local company. Vietnam people and the staff very smart, intelligent, and then they very work hard. And the labor cost now Vietnam can compete to other country. That's why this is our advantage. And for the government to support for the local company a lot, they support for us to enter to the tender to compete with the foreign product. Medical device, raw material, very top. We still import a lot. But for the target, we would like to reach. The target is from 30% to localize, and then to 50% and 80%. And some product we already produce 80% in Vietnam by material in Vietnam, but some product we cannot. Example for the stand, the shipping, we cannot produce here, so that's why we had to import the shipping. But the local company always would like to have more and more investor from supply chain for the material also. So that's why we hope that in future, if some company will come and produce. Yeah, and even for the testing, if we would like to test the product, Vietnam lack of the lab, international lab. So that's why we have to send out to Germany, to US for the testing. So that's why it's a long time and very expensive. If Vietnam have to be open much for the medtech company, so that's why I think some lab center will come.
You lead a team of highly skilled engineers in an environment where precision and discipline are everything. What are your guiding principles in leadership and corporate culture?
In my company, now nearly 200 staff, and almost we have 94 engineering that we have to train for them. You produce, and the R&D, you produce the product safe for the patient. So that's why, with this meaning, with this the slogan, they feel that they're proud to can contribute to your country and to the world with the product. This is the mindset. Every USMer, they understand what they're doing now. And the second one, with the leadership, we almost to train for the people. We select the talent We select the talent and train for them the leadership. Because some engineering, they can work very hard, they know excellent, but they don't know how to manage. Yeah, they don't know how to lead. So that's why we invest for them. We give them how to make decision, how to manage your team. So that's why we invite a lot of people and come to train for them. Yeah, and this time we send two engineering go to Germany for study to look like the EMBA for let them think and let them feel and let them study and then they come back to service to the company.
Amazing. What has your journey taught you about resilience, confidence, and leadership? And what message would you like to send to other women pursuing technology and industry in Vietnam?
In Vietnam, you see that nowadays, not only men, the women more successful than already women. We have to study in our industrial very hard, but the woman always hard working. When you see that very difficult, you want to jump, you want to reach, and you try to reach. We cannot compare woman and the man. We are the same, but on the woman, we have in our blood. Yeah, I think that the woman can, if you want to do, the woman can do. They never give up. If they feel that this is a target they need to reach, they can do it.
Yeah, they have the determination.
Yes.
Yeah, and the ability.
Yes, ability. They can do it. Yeah, that's why I think if you can have a dream to become the successful for your career, you should follow and you should try to reach the target and you can successful. I think that.
Thank you so much for joining us today and sharing your incredible insights and your amazing journey. I wish you so much success with your company. Thank you so much for joining us today.
Thank you.
Vietnamese entrepreneurs have been striving for world-class manufacturing, mirroring Vietnam's own transformation from a developing nation to a rising technology hub. It also shows what can happen when government policy, scientific ambition, and private entrepreneurship move in the same direction. For Vietnam, the road ahead in healthcare manufacturing is filled with opportunities to build domestic capability, strengthen resilience, and provide equitable access to life-saving technologies. This is the Executive Talk. Until next time.